This is Dr. Umesh Kashyap. I am specialized in clinical and non-invasive cardiology, and today I have an opportunity to speak to you all regarding hypertension and its sequelae. What is hypertension and ये हमारी लाइफ में क्यों इम्पोर्टेंट है और हमें इससे कैसे डील करना है. The advantages of dealing with hypertension is that this is a disease which can be easily detected by a primary physician or a health worker. We can start its management at an early stage so that the complications can be reduced to a greatly. Now I will come to a very logical approach to the patient who comes with certain symptoms which are very vague from the patient point of view. But when we clinically evaluate the patient, जब हम उस patient को उसके symptoms के बारे में पूछेंगे, उसकी तकलीफ के बारे में पूछेंगे, then we can come to know whether the patient is suffering from hypertension or it is a psychosomatic disorder. When patient presents, he comes with history of headache, transient headache. At times he gets headache early in the morning, at times he gets the headache in the evening hours. Then he will say he will have giddiness, सिर में चक्कर आता है उसके. He will say then he will have fatigue, बहुत जल्दी थक जाता है. या थोड़ा सा भी काम करे, थोड़ी सी सीढ़ियाँ चढ़े, थोड़ा सा पैदल चले, चढ़ाई चढ़े, तो he starts getting symptoms of breathlessness. सांस फूलने शुरू होती है उसकी. At times patient comes with history कि मेरी सवेरे सवेरे throughout the day he is comfortable, but when he goes to his bed, जब सोने जाते हैं रात को, तो उनके पैरों में swelling होती है. So these are the symptoms which the patient usually present with. Now we have to evaluate it clinically whether he is suffering from hypertension or not. We have to ask the patient what exactly is his effort tolerance, how active he is at present and how active he was in the past. What is the duration of his inactiveness? What is the duration of his present complaints? Present complaints में हम उससे पूछेंगे कि आपको headache कैसे होती है, कब होती है, क्यों होती है. Giddiness, when do you get? Whether it is with a change of posture, whether it is lying down, or whether when he starts walking. He gets breathlessness, he gets chest discomfort. When does he get this thing? Whether he gets it at rest or whether he is getting it on exertion or with minimal activity. So this is how we will clinically approach to the patient, and then we will see the patient, we will measure his blood pressure. Now I'll tell you, there is categories of blood pressure which has been recently classified. Is a normal blood pressure we consider is less than 120 systolic, and less than 80 millimeter of mercury is the diastolic. This is the normal blood pressure. Elevated is when we see the blood pressure is more than or equal to 130 systolic and more than or equal to 90 diastolic. Stage 1 hypertension, stage 2 hypertension is definitely a raised hypertension from what we see from the elevated stages. That will be more than or equal to 140 millimeter of systolic blood pressure and more than or equal to 90 millimeter of blood pressure. There are certain stages, there are some special categories of hypertension where we see hypertensive emergencies or hypertensive urgencies. They are a little complicated, and we'll go into, I'll tell you briefly. Hypertensive emergencies are that where the patient presents with evidence of end organ damages. Hypertensive urgencies are where the patient doesn't show any damage to the end organ, but there are probabilities are there. How to measure the blood pressure? This is the most important thing in clinical scenario. We have to make the patient comfortable because the most important is white coat hypertension. The moment patient enters our OPD, जैसे patient हमें देखता है, हमारा white coat देखता है, he sees a stretch around the neck, इससे पता लगता है कि मैं किसी डॉक्टर के पास जा रहा हूँ और अब मुझे कुछ ना कुछ उल्टा सीधा सुनना पड़ेगा. So that is where he gets, he may get a blood pressure raised in that status also. So that is a white coat hypertension. We have to make the patient comfortable. We have to talk to him. First, we have to take his clinical history. By the time patient becomes a little conversable with you, and then patient becomes a little comfortable also. Once the patient is comfortable, he should be in a lying down position or he should be in sitting position. We have to tie the cuff above the brachial area, and mostly the brachial blood pressure measurement is the most recommended one. The second most important thing is we should measure blood pressure in both the arms, because if there is a variation in both the arms, we can come to know that there is a peripheral vascular disease that is leading to constriction of some arteries and the one of the limbs. Why in that reason, why this in that limb the blood pressure has come down, or is it varying from the other limb? So we have to measure blood pressure in both the arms. Number 3. Number 4. If we have to measure blood pressure in a patient, we should take 2 subsequent readings, because we may get a higher reading the previous one than the next reading. So we have to take both the readings so that we can come to a conclusion whether the patient is hypertensive by virtue of his pathology, or whether it was a presentation of you can say this is a white coat hypertension. Okay, so this is how we measure the blood pressure. Now when we measure the blood pressure, after that we come to one stage when we say that the patient is having any family history of blood pressure or not, what is his kind of job, what is his habit and habitat, what is his lifestyle, whether he is a smoker, whether he consumes alcohol, whether he is idle, whether he is active, then his job profile, because job profile is also very important in these cases, as the most psychological patients who are mostly stressed at workplace, their blood pressure are usually raised. Now we stopped at clinical presentation of the patient and how to see the blood pressure. We'll come to a conclusion that as patient is having a blood pressure. I'll tell you very short, what is the pathophysiology? Pathophysiology का मतलब है blood pressure होता क्यों है, why it happens. See, there are certain reasons why blood pressure occurs. Blood pressure in clinical मतलब जो हमें clinically हम बताया जाता है, अगर हम उसको hemodynamically लें, अगर हम उसको dynamic status में लें, तो blood pressure is hypertension is cardiac output multiplied by peripheral vascular resistance. This is a product of cardiac output and peripheral vascular resistance, that is the blood pressure. Now if we control the cardiac output, or if we control the peripheral vascular resistance, we can control the blood pressure. Now what is the pathophysiology of hypertension? Mostly it is the endothelial dysfunction due to the endothelial progenital cell dysfunction, जिसकी वजह से हमारी वेसल्स के अंदर में नाइट्रिक ऑक्साइड एक कंपोनेंट होता है जो वेसल्स को डायलेट करके रखता है, और जब नाइट्रिक ऑक्साइड कम हो जाएगा तो वेसल्स विल बी कंस्ट्रिक्टेड. कंस्ट्रिक्शन ऑफ वेसल्स मीन्स द रेजिस्टेंस विल इंक्रीज. Resistance will increase means the blood pressure will increase. So it's an endothelial dysfunction. That is one of the reasons. Most important these new days is insulin resistance is there. Insulin resistance can cause to metabolic syndrome. Metabolic syndrome is dyslipidemia, central obesity, prehypertensive stage, and insulin resistance. That again leads to the sequelae of hypertension. Then comes tachycardia or the increased heart rate. जब धड़कन तेज हो जाती है, जब धड़कन तेज होगी, tachycardia will be there, palpitation will be there, patient will have definitely an increased cardiac output, and again it will come to hypertension. So this is the pathophysiology. This is why the hypertension occurs. So we come to the management of hypertension. Management of the hypertension in a patient who is a layman for us, and he doesn't know what is hypertension. He came with the presentation of certain symptoms which led us to a clinical approach that the patient is hypertensive. Now, how we will manage the patient? We cannot tell the patient, or we should not tell the patient that I'm going to start on medicines straight away. We have to give him some tips which he will accept, which he has to regularize in his normal regular lifestyle, so that can also help to bring down his hypertension. In the part of management, first we'll come with the non-pharmacological management. How we'll start non-pharmacological management? First we go with the lifestyle modification. We have to tell the patient, you have to change your lifestyle. One. Then stop smoking. Stop consumption of alcohol. Regular physical activity. Dietary restrictions. Weight loss. And psychological stress has to be reduced somehow if you can manage it. This is how we can advise him a non-pharmacological approach. But that is not sufficient for a patient with hypertension, because we cannot assure ourselves that what we have advised, जो हमने उसे बोला है, that he will maintain the same profile at home. तो हमें उसको प्रोटेक्ट करने के लिए, उसके एंड ऑर्गन्स को प्रोटेक्ट करने के लिए, उसकी बॉडी को प्रोटेक्ट करने के लिए, उसकी फिजियोलॉजी को प्रोटेक्ट करने के लिए हमें उसे मेडिकेशन तो देनी पड़ेगी. सो वी स्टार्ट विद द फार्माकोलॉजिकल अप्रोच ऑल्सो. Pharmacological approaches में we have a setup of drugs that starts with diuretics, that start with calcium channel blockers, ACE inhibitors, angiotensin receptor blockers, aldosterone receptor blockers are there, beta blockers are there, alpha-1 blockers are there, centrally acting antihypertensives are there. This is a line of drugs which can take care of his hypertension very easily. But the most important thing is his lifestyle modification. If his lifestyle modification is not there, our drugs will not act to the point which we expect from the patient, So the most important is what we give him is a non-pharmacological advice. Lifestyle modification, उसे बोलना पड़ेगा कि तुझे सिगरेट छोड़नी पड़ेगी. Consumption of tobacco in any sense, whether it's a chewable consumption, whether he is a smoker, whether he consumes tobacco in any sense, we have to stop that one. Number one. Number two, we have to moderate his alcohol consumption. Number three, his weight loss is very important, because central obesity can lead to so many diseases, so many syndromes. That is most important is the comorbidities which usually coexist with hypertension, as the diabetes. In India, we have to have non-pharmacological approach to the patient's first step, and then a pharmacological approach, so that patient can be saved from his end organ damages. End organ damages are very important because it's a silent killer, hypertension. Why? Because it damages your heart, this cardiovascular system. It causes damage to the cerebrovascular system. It causes damage to the renovascular system. It causes damage to the eyes also. So these are the complications which can cause a permanent disability to a patient who is suffering from hypertension. And if his hypertension is not taken care properly, or if the patient doesn't cooperate, doesn't follow your advice, then he comes to a dead end where he gets damage to so many parts, so many physiological, so many pathological, so many systems of his body are damaged, and then he becomes disabled. So thank you very much. I have tried my level best to explain everything in a very layman's language where hypertension can be understood and it can be taken care of properly, so that we don't get any complications, we don't get any disease form where the hypertension has complicated someone's lifestyle also. So thanks again, and please follow my advice and take care of your health. Your health is most important for us, for the country, and for your family. Thank you very much.